We are Group C, and we are going to be presenting the nursing process.
Okay, well, y'all begin.
Okay.
Playing the role of the patient is Johnny.
Hello, Mr. Robertson. How are you today?
I'm alright. I feel it.
You what? You're not feeling good? Your family's gonna be here soon. Are you ready to go home?
Not really.
Okay. The LVN's gonna be with you, okay?
Hello, Mr. Robertson. How are you feeling today?
I think I feel bad. Can't walk.
Oh, okay. Well, we're going to get you feeling a lot better. I'm going to go ahead and take your blood pressure. Actually, let me go ahead and just see how you're doing. Are you doing all right with your feet? What we're going to do is we're going to take your blood pressure. Did you sleep all right?
Got a little bit of sleep.
Okay. All right. And then we're gonna go ahead and we're gonna check your pulse and see how you're doing. Your breathing. I'm sorry? Oh, you're hungry? Okay, well let me go ahead and get you something to eat, and Nurse Bobby will be in. It's gonna take a long time. So what's
Dad.
wrong now?
How you doing, Dad? Feeling all right?
I'm alright.
You almost ready to get out of here?
Hurry up.
Are they already gonna discharge him or what? How long are we gonna have to be here?
I don't know, we'll probably be here a long time. It's probably gonna be expensive too.
I know.
My feet too good. Legs hurt. Can't stand up.
You can't stand up? Who's gonna take care of him? Are you gonna take care of him? Like, you know, I just got accepted to Coast Bend. I'm not gonna be able to stay home and take care of him.
Hello. Hi.
Hi.
Hi, Miss Robertson. How you doing? I'm Nurse Bobby. I'm here to tell you about a little bit what's going to go on before we discharge you, okay? You suffered from a stroke, as you may know, obviously. How are you feeling? You feeling okay? Or
I'm not feeling okay. I can't eat, can't swallow. Legs, I can't stand up.
Back to work. Don't go too much. Just try to do okay.
Don't tell me what to
Well,
do.
it's frustrating. It's frustrating for stroke patients, and you know we're gonna do everything we possibly can to make sure that you know you're feeling a lot better. We've set up a plan of care for you.
Is he gonna go home or are we gonna take him to the nursing home or what?
Nursing home.
That's gonna be expensive.
Yeah, we're gonna set you up with the American Stroke Association. They're gonna be able to tell
American
you.
Stroke Association? I mean, how much do we have to pay for that?
It's a nonprofit group, and they're going to be able to tell you about places you can go to for services for victims of stroke, things like that. We're also going to recommend you to some local groups to where they can help you guys while you're dealing with this. Mr. Robertson, because of your stroke, you're currently suffering from a lot of hypertension, things like that. So what we're going to want to do is we're going to make sure.
What does that mean?
Hypertension is high blood pressure, basically. And what we're going to be doing is making sure that you're diet is well balanced. It's going to be mostly a liquid diet because he's having trouble swallowing. He can swallow a little, but you know it's still a bit problematic for him.
Like with the straw?
Yeah, with a straw, or you know, if you want to help him with a spoon, things like that. That's also a good independent activity that we would recommend he try doing.
So we have to sit there, feed him, so he doesn't choke.
Yeah, at least for the first week or so. What you want to do is encourage him to start, you know, eating, drinking on his own, things like that.
Drinking alcohol?
No.
Not take alcohol?
The diet is restrictive on alcohol, things like that. No smoking whatsoever. And it's going to be very low in cholesterol, sugars, and salts. And
Can
also,
he do anything for himself?
Yeah, eventually. It's gonna, at least for walking, it's gonna take about probably 2 to 4 months.
That long?
Yeah, it's gonna be a lengthy process, but you'll get there. We're gonna they've set you up with some rehabilitative care to make sure that everything's gonna be working right. We're gonna be recommending that he exercise daily, at least range of motion exercise every 4 hours, every day. And I'll go ahead and show you. The range of motion exercises are pretty simple. Excuse me, Mr. Robertson. You simply just, you know, we'll be taking his arm and just, you know, bringing it up to the side.
How often
Things
should we
of
do that?
sort. Every 4 hours, and you're going to want to be bringing it back here, like so, things like that. Just make sure that his circulation is running.
Is he in pain? Are you in pain, Dad? Do you feel any pain?
You know if he was in pain.
Throat.
His throat?
Starts.
Are your feet swollen?
And especially for the problems with swallowing, things like that, what you can go ahead and do is there's a few exercises to where you can encourage his swallowing, things like that. What you want to do is, what you want to do is usually in his throat.
Is this going to take long? Because I gotta think
What about me?
What
Never
you-
think about me.
What you're going to want to
home taking care of Mom.
said about drinking. That's when I have to do that.
Your mom's a girl.
What you're going to want to do is you're going to want to take at least 1 or 2 fingers, place it gently on the throat, applying a little bit of pressure, and would you swallow for me, Ms. Robertson?
Is that going to help him swallow the food?
Yeah, and it's going to encourage that he work those muscles there and things like that, and so that he'll begin swallowing again. Also, you want to be doing some sort of maybe like facial movement exercises, things like that, so that way he can eventually independently swallow, things like that. We're also going to put you on as I said, Helbrin, which was an anticoagulant, and it clots, prevents blood clots. Be careful with that. He may be more susceptible to bruises, cuts, things like that, and it'll.
Is he going to be able to swallow that?
Yeah, you might want to help him by not forcing it, but you know, when he has the pill in his mouth, being able to, you know, loosen the muscles here, things like that. Are there any questions that you all may have?
How long is it going to take for him to walk?
Yeah.
That's what I was
It'll probably take about 2 to 4 months. But again, if he follows the rehabilitative care, that could go much quicker.
But combing his hair, brushing his teeth, we don't have to mess with that.
You might want to help him at first, you know, obviously. But positive reinforcement is always key. So what you want to do is you want to make sure that he's getting back to doing his own independent activities, you know, just combing his hair, brushing his teeth, things like that. And if you all have any more questions, you know, just let us know. Mr. Robertson, if you feel any more feelings of hypertension, you know, if you feel any symptoms of high blood pressure, if you're getting headaches, or, you know, if you're feeling generally worse, just come back and see us immediately, okay? Okay.
Thank you.
Thank you so
Thank
much.
you.
You all have a nice day.
Bye-bye.
Okay.
You heard that. You're going to have to work with it.
Tell me out the bed, baby.
We're done.